I'm an anaesthetist, and when I was in training, when I was a baby doctor, I heard a talk about mercy ships. It was another junior doctor who had spent a few months on the ship, and she said it was the best experience of her life. And it's something that I've also had a heart for all of my life, is that I wanted to spend some time in places less fortunate, where I could use my skills and medical background to help. So it's something that I just think it's a story that sells itself, that we come and we give free surgery to people who need it the most, who have no access to basic healthcare, let alone other things. So it's wonderful. I think a lot of the patients that we see, the first time they ever have any kind of interaction with a medical professional is when they come onto the ship. So a lot of the patients have never taken simple things like paracetamol, never gone to a doctor, would never had an ailment. And so really, I mean, the healthcare is pretty basic here, and they have to pay for it. So there is healthcare, but they have to pay for it. And so here we have this amazing ship, and we have a beautiful hospital, and we offer high quality surgical care in a number of specialties. So at the moment in Sierra Leone, they don't have an oral surgeon or maxillofacial surgeon in the government system, and so all of our one of the specialties that we're covering right now is maxillofacial surgery, and that's something that they don't have access to here. We also do pediatric orthopedics, reconstructive plastics, pediatric general surgery as well. And they do have some access to general surgeons, but again, they have to pay for it. And sometimes the small cost of what it is here is unaffordable or inaccessible to the patients. So all of our intensive care patients are post-surgical patients. And so it might be that they need post-op ventilation, it might be that they've had a pneumonia in the intraoperative period, or it could be that they've had some airway swelling after surgery, which requires extra support. And so those are the kind of patients. Usually nearly all are surgical in nature, and they might use the ventilator. I think that Hamilton, you guys were just a great partner from the beginning. You answered on time, and you gave us a good and you kind of orientated us to what you thought would be the best ventilators for us, and worked with us in a really cohesive and collaborative way. So when we looked at a few, and people had the most experience with the T1. It was compact and nice to look at, easy to use. The interface was good, and so we made the decision to go ahead with Hamilton. We have anesthesiologists who come in every couple of weeks, and it can be quite intense to train them on all of the different devices. But like I said, again, one of the reasons why we chose Hamilton was because the interface was easy to use, and so we're grateful for that. I would say that it needs to be user-friendly in a hostile environment. It doesn't feel hostile, but I think that, at the end of the day, a few times a year we sail this ship and we move to places, and so that's dissimilar to a normal land-based hospital where a ventilator would just stay in one place. And so it needs to be easily transportable. It needs to be something that we can pack away easily, something that's hardy, so if it got dropped because of the frequent moves, it would probably survive. And again, the T1 met all of our needs. I think that it's a great ventilator, but I'm pretty happy with it.